Today's presentation again is going to be on PPEs and environment and understanding healthcare carbon footprint. And we have Madeline Ashcroft, who's been a nurse for 50 years, trained at Nightingale School, London, England, and worked in many specialty areas before getting into infection prevention and control for many years before SARS hit Toronto. She's going to be doing our presentation today. Madeline has worked in IPAC and acute chronic and rehab hospitals, long-term cares, and also regional networks, including Public Health Ontario. She's worked with World Health Organization as well with the Ebola relief. Madeline has a Bachelor of Science in Nursing from the University of Toronto and a Master's Health Studies from Athabasca University. And she's also the past Director of Standards and Guidelines for IPAC Canada Board and representative to the Canadian Nurses Association, including as a CNA Board Director from 2016 to 2018. In 2021, Madeline launched the Trillium Health Partners Community Outreach IPAC Hub in Mississauga and South Etobicoke, which we are, some of us here may be a part of as well. And this IPAC hub also supports congregate living settings in Mississauga and in South Etobicoke. So without further ado, I would like to introduce Madeline Ashcroft. Thank you again, Madeline, and I'll hand it off to you.
Thanks so much, Dale. And thank you everyone for your time today. I'm not sure if any of you have participated in any of the Cascades webinars, but I do have a link later on in the slides. And if you have, or if you do, you'll see that I stole some of my own slides from a previous presentation as the intro here. So let's get started. So these are my objectives, or our objectives today, that by the end of this presentation, you will be able to describe how healthcare and anything to do with infection prevention and control like PPE and the environment impact each other. You'll be able to highlight how PPE contributes particularly to climate change and plastic pollution, and hopefully practice good stewardship in the use of PPE in your day-to-day work. So a lot of people say to me, so, what's the big thing here? What does climate change have to do with infection prevention and control? And really are a lot of links, and that'll be explored in our position statement. So we'll take a look, but you can see it's just a sampling here of some of the impacts of climate change. So climate change, as we say here, impacts the health of humans and all life on the planet. So I don't expect you to know all these things here, but basically this model is from the CDC. And if you start at the left, top left here, you can see that extreme heat over here causes illness, deaths, and cardiovascular failure. And then you can see also here that severe weather contributes to injuries, fatalities, and mental health impacts. Air pollution causes respiratory issues such as asthma and, cardiovascular problems. Changes in vectors, that's insects in particular, will increase the risk of various diseases. Malaria, not so much, we're not in a malaria high risk yet, but if our climate gets hot enough, we could see malaria being, appearing more in Canada. Dengue, encephalitis, hantavirus, Rift Valley fever, Lyme disease, we're getting more and more of that. West Nile virus, chikungunya, I say it wrong all the time. And then if we look at increasing allergens, more allergies, more respiratory problems and asthma, and then water quality, which impacts things like cholera, cryptosporidiosis, and Campylobacter, leptospirosis, and harmful algae, all kinds of things here. And then water and food impacts lead to malnutrition and diarrheal disease. And then if you look a little further, you'll get the environment degradation. So there's people are forced to move in other countries in order to get food and water, and they have mental health impacts from that. And then finally, we're back to health-related heat again. So there's a lot of things that have to do with climate change and what it does to the human body. And infection prevention and control, we like to say we aim to keep patients or residents, clients safe and reduce costs. So enhancing quality improvement. We would like to say we're working for quality improvement. So we want to help to lessen these sort of effects. One of the things that surprised me was that the World Health Organization says that, sorry, my screen is so big I can't see the top of it. 1 second, I'll try and make it smaller. Climate change is happening now, and its impacts are being felt around the globe. So it's 1 in 4 deaths that World Health says is attributed to preventable environmental causes, and climate change is exacerbating these. And you can see this quote was from 2015. So that was 11 years ago. That was a problem then. It's not getting better. It's just getting worse and worse. From a health perspective, there's an additional 250,000 deaths per year predicted between 2030 and 2050. And particularly around heat-related illness, infectious diseases, non-communicable diseases, and adverse effects on those who are pregnant. West Nile virus continues to grow, and there's even links with multi-drug resistant Candida auris, which showed up in 4 different continents around the same time. It's been linked to global warming. So the indirect disease burden from air pollution and toxic emissions is now at a level of medication errors that led to the patient safety movement. So if you think about how there's so much emphasis on medication errors in healthcare, and the patient safety movement arose from that. Well, this is the same level of threat. Another illustration here that might help too highlights the social and environmental impacts of climate change, which aligns with the previous one. And this is from World Health again. The other one was CDC. This is World Health. But you can see very simply here that, you're getting the environmental change causing natural disasters, degradation, rising sea levels, the Arctic's melting, coral reefs are dying. Although coral reefs did better during the pandemic because there was less travel, pollution, etc. People weren't going out and about and doing so much damage to the environment. Then there's acidification of oceans, climate change affecting food security and water, disrupting the economy, leading to conflict and potentially terrorism, wars, and so on, over food insecurity and so on, and trying to get land, and vulnerability overall. Those who are the least able to cope are the ones who are the most impacted in other countries in particular. So I guess we're lucky in Canada, but we're all part of the bigger, wider world. And this is also another sort of shocking thing, that if the global healthcare sector was a country, it would be the 5th largest emitter of greenhouse gases on the planet. So healthcare itself is a huge contributor to the problem that we strive in healthcare to remedy. So if we could prevent it, that would be wonderful. So how come? Well, medical equipment, when you think about it, it's got to be brought to somewhere, right? Transportation. So you've got your transportation costs. So that's big on its own. But single-use items, particularly their packaging, their microplastics that break down and are now in the food chain, in the water, in the air, in biofilms that contribute to antimicrobial resistance, and inside us. And nanoplastics are actually in our cells. So we have, if you think about it, plastics were not in use before the 1950s. So it was the 1950s that plastics became more and more in use. There's so much that we don't know about the impact of plastics in our bodies. So I'll talk about that in a moment. But if you look at this slide here, about 8 million tons of pandemic related plastic waste were estimated to have been generated globally. That was just up to August 2021, which really, first year of the pandemic. And most of it came from hospitals. And about 25,000 tons of that ended up in the oceans. And disposable medical equipment use more than doubled between 2005 and 2020 and has continued to rise exponentially since then because we use more and more personal protective equipment during the COVID pandemic, but also more and more things tended to be single use for a number of reasons. And PPE in the environment. Well, here we go. 25,900 tons generated was pandemic associated. Here's your single use in the oceans, in the landfill. I particularly like this slide because I didn't realize how bad gowns were. So single use gowns, if you look here, this is the carbon footprint, if you will, of the CO2 production. So the orangey bit of each bar is what it consumes to make the thing. The yellow is what it contributes in waste. The orange is the transportation component, and the blue is electricity consumption during manufacturing. So, gowns, single-use gowns are pretty terrible. And it's been estimated that the damage to human health is 239 disability adjusted life years, impact on ecosystems 0.47 species per year. So that's loss of local species, and the impact on resource depletion, 12.7 million US. So these are just some of the documents I've been able to access. There's one link at the bottom there is IPAC, the enemy of sustainability. And, that's been what's been considered. Oh, you just better be on the safe side, and do a single use because, people don't reprocess things properly. But actually, we need to be better at what we do and not just resort to the easiest thing, which is so detrimental to the planet. Now, this is interesting, again, from the point of view of how come it all ends up in the ocean and in the air. So this is a kind of diagram showing how the PPE ends up. It might be properly put into landfill, but ultimately some of it might blow away. Some of it might be incinerated, and then it goes straight up into the air, by atmospheric transport, gets distributed in all sorts of remote areas, might flow down rivers into the ocean. It might leach into groundwater, impacting marine life, or float in the seawater. Microplastics then in the ocean can be pulled up in rain and then be again dropped over. So, maybe sometime soon we'll be told what our microplastic level is today, as well as our temperature and humidity and air quality, because it is a big issue. And then, of course, it gets into us. So how does it get into us otherwise? Well, we breathe it in if it's in the air. We ingest it in the food chain. So even thinking about when we have a mask on our face, the mask is plastic. There is some of it, touching us and being breathed into us. We don't want germs, but also, we don't want to become 100% plastic either. So just thinking about these things, how it's in the food chain, at all levels, and then we consume. I'm not saying we can consume sharks and tigers here, but basically it impacts us at all levels. It can cause intestinal damage, lung injury, cancer, and cardiovascular diseases. Certainly there's a very large increase in cancer in younger people, and they don't really know why. But, it's maybe plastics. And this is an excellent document from World Health Organization about the dietary and inhalation exposure to nano and microplastic particles and potential implications for human health. And a lot of what it says in there is that we don't really know exactly what it causes. We know about hormone disruption, but we do not know at this point. There's not enough studies to show us exactly what plastic is doing to us. However, we know it is in every organ of our body now, including our brains. So these are other position statements that others have looked at professional organizations like the Canadian Medical Association, Canadian Nursing Associations. You can see some of these 2009, like that's 15 years ago, right? Is it 15 years? Yes. And then anesthesia, they've been doing quite a lot about circular economy and so on. And so it's not that there's never been any position statements. There have been plenty, but it doesn't seem like it's really, there's lots of calls to action, but where's the action? And I think we are the action. We have to take action. The Lancet is a wonderful resource now. It is a British medical publication, but they've been doing a great deal about climate change, working with Yale and so on, and countdowns and so on. So they're saying that last October, the mean annual temperatures exceeded 1.5 degrees centigrade above those of pre-industrial times for the first time in 2024, the previous year, because they report, from the year before. Despite even more urgent calls to tackle climate change, greenhouse gas emissions rose to record levels that same year. So things continue, despite efforts that people are doing, things continue to be an issue. I'm just showing you this because the IFIC, the International Federation of Infection Control, had a great little presentation. If you happen to be a member or you know anybody who's a member of APIC, that's a great presentation members can watch. But what I took from this particularly is if you look for carbon dioxide reduction, obviously, if you can reduce the use of something, you don't use it, or you can reduce the use of it, then you are saving, reducing carbon dioxide by 100%. If you reuse it, it's 38 to 56%. If you recycle it, it's 3 to 4% perhaps. And if you use single use, it's 0%. I didn't realize myself how recycling was better than nothing, but not that much. So if we can reduce our use things, in a effective way and mindful way, that's the best. Just a few little terminologies here, which you don't, I'm just putting this in so you can have the presentation afterwards if you want to refer to it, checks, links. But a circular economy is a term that's used a lot by people who are, wanting to green the environment and healthcare and so on. It's an economy that retains and recovers as much value as possible from reusing, repairing, refurbishing, remanufacturing, repurposing, or recycling. And I think this is a nice little illustration there. But it's actually the government of Canada has this definition. They have a web page and so on. So it's really, instead of, linear throw away, you buy the thing, you use it, you throw it away, it's extending the life cycle. And so many things in our day-to-day lives are have built-in obsolescence, right? You don't expect your appliances to last more than something like 10 years or something. I think that's terrible. So the government is supposed to be behind this, right? There's funding for all these things. So it's not to say, well, the government's not doing anything about it. We have to do it. We have to work with the government to do it. And that's the way I'm viewing this as well. These are some other terminologies or metrics that can be used too. And I'm not expecting anybody to know about this, but I thought just in case you were interested, quality indicators they use include the carbon emissions that we spoke of, the energy consumption and the use and transportation of the items, how much water is used, how much waste is generated, including plastics, and any social or governmental metrics that they might add. But for carbon emissions alone, there are the direct emissions that come from making the thing. Then there's the indirect emissions from electricity, steam, heat, cooling that are associated with the product. And then the supply chain, how it gets there. So you can see there's a train here, there's trucks here, and so on. but just, you know, there's a lot of different elements involved, and it can be quite confusing. I think that we need to all be aware of is greenwashing. We need to be sustainability literate. Don't be fooled by greenwashing, which is a deceptive practice that can be used to mislead us about a company's or a product's environmental practices or the benefits of their product or service. And sometimes you'll see things they say natural or eco-friendly, but when you dig a bit deep, not really natural or eco-friendly, or they break down the environment, but what do they break down into? Or they break down rapidly the environment and then they cause increased methane in the landfill. Misleading claims like certified. Certified by whom? By themselves. Irrelevant claims like green or recycled materials. Sometimes things, are taken out and recycled into another product. That's the end of, like a plastic bag. If you can reuse the plastic bag, that's much better than the plastic going straight to be made into polyester for a blanket that every time you wash it, the microplastics go into the water and it's not reprocessed beyond that point. Exaggerating progress. So, they'll call it green hushing. That's, oh, we're doing all this stuff, but they actually don't have a proper plan about what they're doing. And the biodegradables in landfill, as I mentioned, methane emissions. So we're putting that as an addendum to our position statement because there's a lot of biodegradable gloves that are being particularly marketed right now. They cost more money. So some large organizations are purchasing them, thinking they're doing better for the environment. But in actual fact, they cause a lot of increased methane in the landfill, even if they have capture for the methane gas. If you want to look for certification, I would say look for ISO 14001, and this is the environmental management system accreditation, if you will. I haven't found a lot of products with that, but if they say, oh, we're a certified or accredited, say, is it ISO 14001? So this is our position statement, and the QR code's here if you want to scan it, and the link is also as well at the top of the page. March last year that we launched this, really at the behest of some of the anesthesiologists who wanted us to help them with a position statement about ventilator tubing. We said we don't do it just for one thing, but maybe we can do a broader one. And so just sharing this with you. It's longer than our usual position statements, but I hope it will be helpful. Now I'll go a little bit more into detail in a moment. I also presented this poster at our last IPAC Canada conference about trying to get attention for the poster and how working together with other professional organizations really helps to get us ahead on these things and to understand each other. When I spoke before of Cascades, it's not the toilet paper company, although apparently they're relatively green. But Cascades is creating a sustainable Canadian healthcare system in climate crisis, and it's out of U of T and UBC. And they have wonderful presentations and training. It's all free, and webinars and stuff. I am gradually working my way through some of their resources. And my presentation is with some other people from BC and Quebec is also on the Cascades website. A selection of a few other kind of, mostly local collaborative sustainability groups. So just a sampling. Here's the U of T one. They have sessions every year. And Peach, I'll talk about in a minute because somebody said Peach was really relevant to you in your settings. Certainly the website has some good resources. So collaboration, as I'm thinking of it, is that we need to have consumers like us and professional groups, associations, and accreditors and manufacturers all working together. Externally, we need to have the device creators, but within our organizations, if you have an IPAC program, well, you have Dale, but hopefully within your organizations, you have someone who is the IPAC lead as such, who can take these ideas forward, but we have to work together. So for knowledge, for product selection, evaluation, and any kind of reprocessing that we're doing, and the manufacturer's instructions for use. So this is our position statement sort of breaks it down for recommendations under what we think the organization should do, what we think the IPAC program should do, and the individual ICP. We don't get into the nitty gritty of the individual practitioner, health practitioner or care provider. But I think, we all, infection prevention control is everybody's business. So the ICP role is kind of similar. We're all ICPs to some degree, right? So I'm just going to touch on some of these things here. So this is the program action that we said you should have the protocols in place for stewardship, which includes product selection. The organizational leadership should recognize sustainability is part of quality care and include sustainability and impact in the risk-benefit analysis of any things that are used. It'd be great to have a sustainability committee or team, and we would hope certainly big organizations could put that together, or a green team, if you will, acknowledging the effect of infection prevention and control processes in damage to our ecosystem. Include somebody with an IPAC background or representation in any sustainability projects, as well as in any multi-facility buyer groups that you may have. Identify barriers and opportunities to implement the practices that make things sustainable. Adhere to government environmental policies. And work to improve staff literacy. I think that's a big thing. And what you're doing today is improving your own literacy and hopefully sharing this with others. So in planetary health. You look at the program, what the program itself should do, or whoever your IPAC lead is identified. But if we're looking at the program itself, providing input again into the supply chain, looking at ethical purchases and sustainability, and some of the things, is there a local product? I know this was important during COVID when we couldn't get our N95s, and now we have a company in Brantford making them, so that's great. But that also reduces the transportation costs and so on. So there could be things like medical devices, sharps containers, medications like antibiotics, considering what their impact on the ecosystem is, the linens you're using, the detergents you're using, any recycling, disposal, incineration, landfill. When I was a student nurse, well, even after I was a student nurse, we would squirt the leftover antibiotics down the drain. Well, now we know that that's terrible. That really causes the increase in antimicrobial resistance in the water and also in the drain itself and so on. So, things change. People need to understand what they're doing and where they're disposing of things, and even things that go to landfill. Recognition reuse is often the best strategy, followed by recycling and waste separation. This is the new bullet we're going to put in. Consideration that biodegradable items, gloves, masks, for example, may not be better than conventional items, as their rapid biodegradation in anaerobic landfill conditions produces methane gas, which exacerbates climate change. Think about your selection of your chemicals for environmental cleaning. Some things are very toxic to the environment. Can you use something that's more environmentally friendly? Review of the manufacturer's instructions for use. So considering products with safe reprocessing over those that say, oh, can't be reused. When in fact, you look at the thing and you say, this is perfectly good, solid piece of plastic or metal, surely it can be recycled. So if you get or reprocess, I should say. So if you get another company, that can offer that, that's the way we would want to try to look. We push the manufacturers to give us what we want as the consumers. And requesting clear and consistent reprocessing guidelines with their environmental performance metrics, things about ongoing service and availability of replacement parts. That helps with the circular economy. And collaborate with external partners to support extended a producer responsibility. And finally, the IPAC professional, and to some degree, some of you who are working in the field but not considering yourself IPAC professionals, thinking about evidence. So understanding what we are doing and what we're using. The Choosing Wisely, and the link is there, program is really great. It's very simple. It's created as what not to do for patients, really. So it's part of to help patients or for doctors originally, but there's nursing stuff in there now too. And there's all kinds of health professional advice in Choosing Wisely. It's Choosing Wisely lists. Balancing the desire to remove all infection risk at all costs with the need to protect the planet and the population's health. So, as I mentioned before, it was, we can't trust people to do a good job with reprocessing, so we're just going to use single use. Well, no, we have to do a good job with reprocessing. You trust people to use their PPE properly. You can trust them to, say, reprocess a eye protection, for example, not gowns and gloves, not gloves and masks, but eye protection could be properly reprocessed by the individual who's going to keep using it. It's dedicated. Focusing on prevention. So if you can prevent, obviously, you're going to save all those resources and reduce pollution. Looking at the costs and benefits, not just financially, but the environment and the people internally and externally. Reflecting on your practices to support sustainability. I'm going to talk about this in a minute. Personal risk assessment for the use of PPE. I've met so many people who say, we put it on. We put it on before we enter anything, because who knows what you're going to touch or whatever. It's not really necessary. Make your personal risk assessment based on what you know and what you see, and use your PPE appropriately. Think about minimizing waste and how those opportunities might be, not overusing PPE, making sure that you keep an eye on expiry dates, and rotate your inventory so things don't expire. And then disposable items, like if it's clean and unused, maybe you don't need to discard it. Maybe you can use it for your training purposes. Maybe, there's other things you can do than put it in garbage or landfill. Reinforcing hand hygiene and no-touch techniques rather than glove use all the time. People put gloves on, as you know, and they touch everything. They think they're safe, but really they've just spread the germs around for everybody else. So hand hygiene, first and foremost. You always need to clean your hands. You may not necessarily need to wear gloves. And monitoring things like reprocessing, so including cleaning, disinfection, sterilization practices for quality and efficiency or efficacy, rather than just saying, it's better to use single use so we don't have to bother with that. No, and do it properly. And engaging in innovation. So participating in research if the opportunities arise for waste reduction strategies, and holding the manufacturers accountable. They need us for their business. So yes, we need them too, but there's competition out there. And I just learned the other day that there's a number of different wipes, for example, for washing people with that are cellulose and not plastic, or that for cleaning environments that are made of bamboo, not plastic, because all those disinfectant wipes are plastic otherwise. So these are innovative things that have come as a result of, I think, pressure from consumers like us. So moving forward, I would recommend increasing sustainability literacy in infection prevention and control professionals and allied professions, and you guys currently, and students. Let's get people when they're new, they're students and they're learning about this. It should be in the curriculum, right, of all kinds of students that provide the support for our clients. Consider the environmental impact of IPAC products and practices, and work together for better products with reusable as the default, reprocessing instructions from the manufacturer, and replacement parts available, and increasing focus on the impact of plastics on health. One of the things here is that I got a bit of pushback from some people, from colleagues who were doing a CSA standard for cleaning and disinfection. They said, I hope you're not going to give us, put contradictory information. Well, actually, that document really focuses on the carbon emissions and doesn't touch so much on the plastic. So you've got to balance the carbon side of it, okay, water and electricity use, but what about the plastics? So even people who don't believe in environmental change in greenhouse gases and all that, because there's vaccine deniers and there's climate change deniers, but any I've spoken to are very concerned about plastics in their body. So I think you can win people over with one or the other or a combination. I put in brackets here the impact of AI on electricity, water, and land, because that's again something that I learned from the U of T collaboration. I didn't realize that if you ask AI to write an email for you, it's the equivalent of pouring out a bottle of plastic water on the ground. So I thought, well, I think I can write my own emails. I don't think I have to ask AI for that. And the huge amounts of computers that are, taking over certain areas. Sometimes it's farmland, sometimes it's less useful land. And the electricity they use and the water they use to cool the computers. So that's a topic for another day, but it's just like, wow. So let's look at your environment, your work, environmental sustainability challenges in community care. So I was thinking about how community care is probably the least risky, really, for infections compared to hospitals, long-term care homes, and clinics, and so on. Um, However, there are risks. They are different, but they are still risks. So if you didn't have sustainable funding, you might have the most wonderful processes in the world and use great products, but um, you may end up with inefficient procurement. So you have to use whatever you get or whatever's available, as opposed to something that you've really come to the decision this is what you want for your organization. Also, if you have staffing shortages, this so or maybe more misuse of equipment and so on. But if your usual staff know your clients, and that really helps with risk assessment. So new staff may go further, or maybe they don't, and maybe they expose themselves to infections. I would say now this is just me. This is kind of me doing a bit of brainstorming here, and you guys do this more than me now. I did home care VON like I don't know, well over 20 years ago before I went into IPAC, but I know that it's unpredictable, in a home care setting. There could be client infections that you know about or you don't know about. There could be things in the home care setting like hygiene issues, clutter, animals. There could be other people there, spouse, children, who knows, who maybe have infections. So this could lead to an overuse or misuse of PPE because you think, well, I've got to protect myself from everything because I don't know what's here, especially things like gloves, masks, and gowns. And then I was thinking in day programs, clients may hide their symptoms. Perhaps they think, oh, I just got a sniffle and I really want to come to the day program. And so, they'll say, no, I'm fine, or it's just an allergy or something like that. Or maybe they could develop symptoms while they're on site. And then other clients and staff may be exposed in the process. So when I was thinking here, we know that, for example, with COVID, you can have no symptoms, but you're actually infectious for up to 2 days before the symptoms arise. So, I'm not berating anybody. They feel okay, but they're actually contagious. So you don't know for sure. And there's certainly a drive there's a group of people, mostly out of Canada, who have put forward a recommendation that we all wear N95s all the time, including our clients in any healthcare setting, which I think is not a good idea, but we have had counter responses to that. But I think getting really good at risk assessment is what this is all about. In day programs, I think you've got a little bit more of a safety net there. But let's talk about it a little bit more. So I think we're starting at an advantage in home care and community care because you're lowering the overall carbon footprint simply by not being in a hospital. So looking after people in their homes or in a community setting provides localized care and rehabilitation and so on. So there's less travel. There's less of all the things that a hospital, for example, would be using for equipment and all the stuff they generate. Hopefully you would have sustainable procurement. And I know there was an issue recently where people couldn't get their equipment in home care, which was really a terribly worrisome thing. And I know it's being fully investigated now. But that's a risk. And then through collaborative actions. So Peach, for example, I put the link to their webinars. I've got some really cool webinars that a lot of stuff is about hospital, but some of the webinars are about community clinics, community settings, and so on. And then collaborating through Ontario health teams as well to work together. And you in this group, I think, is a wonderful collaboration. You know, you have different organizations coming together, and some of you have some great strategies and ideas that can be shared, and you know, we can affect each other with the ideas and products. At an individual level, best practices for infection prevention and control is a best way for us to work sustainably, including hand hygiene and the appropriate use of PPE, which I hope I've reinforced throughout. Up-to-date immunization for us and for our clients. But for us, if we're healthy, we're not going to come into work. We're less likely, for example, to come into work with undiagnosed COVID. Influenza, by the way, is 24 hours that you may have no symptoms, and yet you can be transmitting. So definitely for those two infectious diseases, it's not mandatory to have the vaccines necessarily, but it's really good on a personal level if you can consider doing that, because you are potentially a traveling germ. And of course, educating others, your peers, your clients, your families about these kind of issues and learning more yourself. I like this APIC poster. It's really for Joe Public. It's not for health professionals necessarily, but 10 ways to protect yourself and others. And they include cleaning your hands, keeping yourself hydrated, getting vaccinated, keeping your environment clean, getting fresh air, practicing food safety, clean, separate, cool, chill, stay home if you're sick, cover your coughs and sneezes, take your meds, and exercise and diet and sleep, it says there too, and keep your personal items to yourself. And I think these are really, that's nice reinforcements. It's nice to have a fresh poster or a fresh visual to remind us. So preventing transmission of infection results in less use of PPE, less antibiotics, less hospitalizations, and obviously less burden on the environment. So I'm going to go into routine practices a little bit here. Dale, can you just confirm, do we have an hour or an hour and a half?
We have an hour and a half.
Okay. I won't necessarily use that amount of time, but I want to make sure we have plenty of time should there be questions.
Yeah, hour and a half.
Okay, great. Thanks. So routine practices. I hope you all know well and truly what routine practices are. What we should be doing routinely at all times with all encounters to prevent the spread of infection, including a risk assessment, hand hygiene, appropriate use of personal protective equipment, control of the environment where people are placed to prevent contaminating or infecting others, cleaning, and engineering controls like HVAC systems, etc. Administrative controls, your policies and your procedures, healthy workplace policies, respiratory etiquette, cough into your sleeve, monitoring of compliance with feedback, some auditing to make sure that not only have you got the policies, but people are actually doing the procedures in the appropriate way. And I also, I put the link for routine practices here. So when you get the presentation, you can click on that and it'll take you to Public Health Ontario resources, best practice documents, and so much more. So do use all the Public Health Ontario stuff because this is your taxpayer money at work, right? These things are being created for your use, so you don't have to reinvent the wheel. So risk assessment, I wanted to focus on this. It's what you should be doing with every interaction with a client, with any client. It's also called personal risk assessment or point of care risk assessment. But sometimes you're not actually giving care, you're just interacting closely with the person. So think about what the person's doing, what the client's doing. Are they coughing, sneezing, speaking loudly? Are there risks of droplets going onto you, onto your face, your eyes, nose, and mouth? Do they appear unwell? Are they flushed looking? Do they appear sweaty or do they have a new rash? Are they appearing to be able to uncontrol their body functions? Are they confused? Are they incontinent, belligerent? Is something going on? And also consider what you're going to do to or with the client. For example, if you're just talking to them, interviewing them, and you're going to face them, then that's more risk than if you could sit sideways on. If you know, at a 45-degree angle where the droplets aren't necessarily going right into your face. You might want to check their temperature or other vital signs to reinforce what you're learning just by looking at them. And that will cause more potential exposure to you. Perhaps you're helping them with mouth care or with eating or cleaning up body fluids. And these are all times when you are more at risk. So this is part of your risk assessment, what they're doing, what you're doing, and what you're going to make them do as a result of what you're doing as well. If you might be helping them with something they're going to make them cough or sneeze, right? So how would you protect yourself? And I'm not going to ask people to put anything in the chat box necessarily, but just maybe make a note to yourself or think in your head, and then we'll go through these one at a time. So how would you protect yourself from touching body fluids or something contaminated with them? Now, a couple of things I put here are hand hygiene and gloves, but also maybe you could use a paper towel to pick something up as opposed to putting your hand on it, About the client's coughing and you can't stay 2 meters away. Well, I'm going to say facial protection, mask and eye protection. We're pretty good with masking, but we're not so good with eye protection. And we don't really have much in our eyes to protect ourselves from germs. We have a little bit of lysosine, but we have many more defenses in our nose and mouth. And yet we cover our nose and mouth and not our eyes. What about if the client's vomiting profusely and asking you for help? I asked somebody this the other day and they said, oh, I just won't. I'll just say, oh, sorry, no, no, we're here to help. We got to work out how we can help safely. So I think at minimum, gloves and probably facial protection if there's aerosolization of vomit. They say that for norovirus, there is a potential risk of aerosolization because people vomit so dramatically and micro droplets can stay in the air for a while. Okay, and what about if the client tells you that they think they have TB? Now, hopefully people don't say this at random, but maybe that's a new client that's come into the system and they've lived in reduced circumstances or something. Really, you should wear an N95 respirator if you are going to have more than a few minutes contact with them. I think that the health units usually say 15 minutes contact. But even so, I would say N95 respirators would be required if somebody suspects they have TB or if they have measles or chickenpox, and you may not be fully protected. So, good to be fit tested for N95 respirators, not just for these things, but also in case there's a novel virus that arises, because the government will say, oh, it's a new virus until we worked it all out about transmissibility. We're going to probably recommend an N95 is worn till we find out more. So always good if you can have your your staff fit tested for N95s just in case. So this is the Public Health Ontario's performing risk assessment related to routine practices. This is two different infographics they have. I always find them a little bit confusing, but are okay if you read through them. But it comes down to the simple thing about think about what you're going to do and wear the right, the right PPE accordingly. And it's all about the chain of transmission, right? You need all these 6 links in order for a germ or the agent to get to the host. So you need the reservoir, a place for it to grow, the portal of exit or the way it gets out, the mode of transmission, the way it travels about, the portal of entry in the next person, and that host needs to be susceptible or at risk. If you're vaccinated and you're healthy, you're at less risk, and this is why we're not always sick all the time. But someone who is old, very young, has suppressed immunity, maybe through chemo, cancer, diabetes, etc., is much more likely to get infected. So just a refresher on that, because I'm pretty sure you all know about this. And then this is the Public Health Ontario image of the chain of transmission and how you would break the chain. And breaking the chain means preventing the infection at all levels, either killing the germ or being vaccinated or cleaning your hands or covering your cough or now it's making me cough. One thing I'd like to point out that you can see I've circled hand hygiene here. Hand hygiene is the single most effective way to break the chain at any given point in time. And this is also another Public Health Ontario infographic, just showing all those elements of routine practice and additional precautions that you can use to break the chain. I'd really like to focus on this for a moment because I think people tend to think that PPE is the first and foremost thing that you need to do to protect yourself. But really, as you see on this hierarchy of controls, it's the least effective way. And if you look at the first one, elimination, physically removing the hazard, that means removing the risk of exposure at source, which could be hand hygiene, immunization, staying home when sick, for example. Those common things we just talked about. If you look at substitution, that means replacing with a safer alternative, maybe like a safety engineered syringe or device and so on, that reduces risks of needle sticks, for example. Engineering controls to reduce exposure, like environmental cleaning and disinfection, optimizing indoor ventilation. Administrative controls, changing the way people work through practices, policies, training, sick leave policies, and so on. And then finally, PPE, least effective, wearing specialized equipment to reduce risks, like mask, eye protection, gowns, gloves, respirators, based on a point of care risk assessment or when indicated. So just wanted to show you that because I know we often think PPE, but there's a lot of other things that are much more effective. So back to hand hygiene, single most effective way to prevent the transmission of germs, how to hand rub, how to hand wash. I'm just wondering too if you can tell me what's better, hand washing or hand rubbing. Maybe put it in the chat. I'll have a look at the chat again in a minute. But if you, we don't really want to put this, but a lot of people tell me hand washing over and over. And recently I was at a hospital infection prevention and control committee meeting, because we are funded through the hospital. They like us to participate in their official meetings. And they were saying, a lot of people are not cleaning their hands because they say that they prefer to wash them with soap and water, or that the alcohol damages their hands and makes their hands sore. Well, alcohol-based hand rub is the gold standard for healthcare, has been for over 20 years. the product's damaging your hands, you have to think why, and you have to, try and get a product that is less harsh on hands because they're supposed to be full of emollients and better for your hands than associated soap and water washing. And it's easier to do. 15 seconds of rubbing either way, but at least with hand rubbing, you're not having to find a sink, water, soap, paper towels, garbage, wetting your hands first, and then putting the soap on and then doing your rubbing and then rinsing and patting dry and so on, turning off the tap with the towel. So, and maybe people are not washing or rubbing properly, not letting their hands dry fully, rubbing till dry before they put a glove on, for example, which is of course going to damage your skin. So instead of saying hand washing, think of hand washing if your hands are visibly soiled or they feel sticky, or you think, oh, I definitely think I touched that fecally thing, But a bottom line is hand rubbing should be the gold standard and it should be better for your hands. I see 3 people in the chat box here, so I'm going to have a quick look to see. Hand wash. Yes, because everybody says hand washing. Yeah, Kimberly's saying yes. You're right, Kimberly. It is the most effective to use a hand rub if you can do so. So really trying to encourage that. Everybody says hand washing everywhere, seriously. But it really, we've been working for 20 years in Canada, the Just Clean Your Hand program, which is also now on the Public Health Ontario website, to try and get people to go-to is your hand rub in healthcare settings. Okay, so I'm going to just review the 4 moments of hand hygiene. Now, this image was for the non-acute settings, and this is part of the Just Clean Your Hands document, so I put the link at the bottom here. But these are around interacting with people. There's plenty more other times, obviously, but before you touch the person or an environment, you should clean your hands. Before you do something aseptic, like maybe a blood test, a blood sugar test, helping with mouth care, where you might touch their mucous membranes or eye drops or anything like that. Then after you've done that, where you may have had body fluid contact, or say after helping someone to the toilet or whatever, where there's a risk that you may have touched body fluids. And then finally, after contact with the person and environment, before you go to the next person. And it doesn't have to be necessarily going in and out of rooms. It could also be, going in and out of someone's home. So moment 1 is before you start doing anything within the home. And the last is as you're leaving. But there would be other times, right, around your personal stuff or when you're preparing food, all these other times. So have a think about that. Okay, then gloves. Let's look about gloves because they are the most misused medical protective devices. And people put them on, as I said before, they feel protected, they touch everything, and they thereby spread germs around. And they are no substitute for hand hygiene. So you need gloves if you're going to contact body fluids, contaminated items, broken skin, or if they're on additional precautions. We'll talk about that in a minute. So consider how you might reduce misuse or overuse of the gloves. So as we spoke before, there are certain times when you need to wear gloves, but when you have gloves, they need to be appropriate to the task. There's little, we call them sandwich gloves. They're probably not really effective for anything and shouldn't be used in healthcare. But do you really need, could vinyl gloves work? Do you really need nitrile, which are much, they're a bit more heavy duty. We tend not to want ones that produce allergies, but nitrile, vinyl, I'd say let's try vinyl as your go-to glove. They are less damaging to the environment. They need to be the right size. If they're too big, too small, they're split, too big, you're not going to be able to do your work properly and you may contaminate yourself. Put them on immediately before you're doing the activity, not going through the door of the room or whatever, just prior to whatever it is you're going to be touching in the way of body fluids, contaminated items, or broken skin. Clean your hands before you put them on. And often people say, why? I'm going to put gloves on. Well, if you have a dirty hand and you put it into a box of gloves, you've now contaminated all the gloves in the box. So you have to think about the next user, which could be you, but could be others as well. Remove them and discard them immediately after the activity, whatever the activity was, on the individual or in the space of the room. And then hand hygiene immediately after you have taken the glove off. Change or remove the gloves if you're moving from a contaminated to a clean body site within the same client. So say, oh, I'm just helping this person with their briefs or something, but oh, now they need something done up near their face. You shouldn't be wearing the same gloves for that. And do you really need gloves for that second body part? So think about that, and can hand hygiene be sufficient? Also the same thing, moving from a contaminated site before you touch a clean site or somewhere in the environment. Do not wash or reuse gloves. Now there are some, the yellow kitchen gloves or heavy duty green ones that cleaning people sometimes use, which can be obviously washed and reused, but they have to be, you have to have a certain protocol for that, and it has to be done in a certain place, not just any old wear. The same pair of gloves must not be used for the care of more than one client. We have a nice little picture of people using ABHR on their gloves and saying no. All right, effective PPE use. So, appropriate use of PPE. If the client is known or suspected of having a transmissible infection, you're going to have to use additional precautions in addition to routine practices. So the precautions would be contact precautions, and that would be things like skin infections, things like MRSA, VRE, a lot of the antimicrobial resistant organisms, but also any respiratory virals, especially seasonal viral diseases that not only are spread by droplet, coughs and sneezes, but the droplets land on surfaces. So you'll need to do droplet and contact in those cases. So droplet precautions, you're going to have a gown. I'm sorry, there's a mistake here. I'm going to have to put, I can't change it right now. I somehow should have put mask in there. So bear with me here. I will change it before I send you these slides. You're going to have a mask for droplet precautions, and you're going to have to probably do your contact precautions, and I'll put that in a link there too. What I was going to say with the plastic apron is in England, they don't give people gowns. They give them plastic aprons instead, and it is better for the environment. So that might be something that you could use more routinely than single-use gowns. You'd have to think about it, do a risk assessment in your organization and so on. But if you're just thinking, oh, I'm bathing them and I'm going to get my uniform or my clothes wet, maybe that's sufficient, because it's not germs, it's just water, when you're helping someone with shower. So please ignore this mistake here. Gee, I thought I checked them. And airborne precautions, and N95 respirator. So these are some signs that they have at PHO for contact precautions and droplet precautions. Otherwise, you need to make your risk assessment as per routine practices. Okay, so gloves. We talked about this before, but gloves, you're going to need them for contact with body fluids or items contaminated with them, not a substitute for hand hygiene, which must be done before and after. Mask for risks of splashes or sprays to your nose or mouth, or to your face. Also for source control if you have a cough or you think you've got something brewing, or you've recently made contact with someone who did have something, and you think you might be getting it, but you have no signs yet. Excuse me. Eye protection for risks of splashes or sprays to your eyes. And consider potentially getting reusable protective eyewear that you can clean and disinfect yourself after each use, like these ones here. And I put the link so you could read more about what's recommended for eye and face protectors. Not regular glasses, not good enough, but ones with flanges at the side and top. The supply portal told me they have these and that they can supply them to people. And they're, if you looked at the diagram that I showed you before, how face shields were pretty bad too, right? A lot of plastic and high emissions. So something like this you could use and clean and disinfect after use and keep it with yourself on your person or in your bag, whatever, would be great. and gowns for splashes or sprays to your arms or clothing. And I ask again, would a plastic apron suffice? So I've got a couple of scenarios I thought we could work through here. And the first one's in regards to home care. So could you maybe in the chat box tell me if you're home care or if you're day programs or where are you? What is your program based in? Is it home care or day programs? And if it's more one than the other, we can emphasize. Both. Okay, Joanne, both. So I'm doing both anyway, but I just thought if there's nobody here oh, okay. If there's nobody here from a day program, there's not much point in me doing it. But thank you. So we'll talk about both equally then. So for a practitioner, if they are visiting Mrs. Green to provide an initial home care visit, so they don't really know her that well, but they've got notes that say that she's 85 years old, she has several chronic health conditions, for example, diabetes and heart failure, and she has limited mobility. But we don't know anything more. As far as we know, she doesn't have any active infections. So I would say, what do you do prior to your visit? And maybe just think this for yourself, or you can put it in the chat box, is what could you do from an infection prevention and control perspective prior to actually showing up at the door? Great, thanks, Kimberly. Yeah, health screening. Now, I'm saying this because you guys know this better than me. I haven't done home care for more than 20 years. But yes, that's what I was thinking too, that you could screen over the phone. I know that we used to phone and say, I'm on my way. Maybe people text now or something, but if are you all right? Do you have any symptoms of like cold-like symptoms or an upset tummy, something like that? So you know a bit better what you're walking into, right? What PPE would you bring with you to the visit? And again, if you can feel free to type something in the chat box, that would be wonderful. But what sort of PPE do you think you should bring to this particular visit? Hank Shams, gloves, mask. I agree. I would say maybe make sure you have everything just in case. It's a bit of an unknown entity. You're not sure what you're going to encounter. So being prepared, I think medical mask, as you said, gloves, maybe gown, apron in with your supplies, um, N95 perhaps as a backup, hand sanitizer, yeah, eye protection, yeah, very good, very good. I didn't put eye protection, but I'm going to now because I should have put that in there, going on about it, but I didn't put it in there. So great. Yeah, just to have it there. You don't have to use it all, but have it there. And ABHR is excellent. It's not technically PPE, but yes, have it with you because it's not likely they'll have some in their home. Sometimes if they're having supplies delivered for dressings and so on, that will come too, but not necessarily. So, and some people like it. When my mother had some home care, I had a pump right by the door when people came in, but most started putting their own on when they got there. What would you do on entering her home? I kind of gave that away a little bit, but what do you think you should do when you enter the home? Yeah, perfect. Excellent. Perform hand hygiene, obviously, yes. And you're making that ongoing risk assessment as well. So you can maybe put a mask on depending on, the source control or what you suspect when you get more of an impression at the doorway there. So that's terrific. And as I say, I'll amend this a little bit before you get it. Maybe you can share these with your with your staff and colleagues. Yeah, the point of care risk assessment, excellent. So really trying to get people to do that more and more. That's wonderful. Okay, so here's a scenario for a day program then. So everyone in your seniors day program, for example, is supposed to self-screen prior to arrival. And if it's not, maybe you've got a children's program, but the family is supposed to, self-screen and help that happen before they get there. And it should be screened again for infectious symptoms once they arrive. And it could be as casual, certainly in the summertime when risks are low and infection rates are down. It could be as casual, just say, how are you feeling today? No symptoms, as opposed to checking anything directly. But anyway, an hour after the program's begun, you notice Mr. Gray is coughing frequently. So my question to you is, what would you do? If he's coughing frequently, what would you do? Feel free to type it in the chat box or just think it yourself and see if we're on the same page here. And again, you and your teams are much more experienced in this than me. I'm just looking at an IPAC perspective these days, but trying to apply. Ask him to don a mask if tolerated. Excellent. Yes. So that's what I was kind of thinking. First of all, I might put a mask on me and clean my hands before I touch the mask and put a mask on me and help to move him away from the rest of the clients, and then dig a little deeper, but also provide him with alcohol-based hand rub and a mask if he can tolerate it. And I put if he can tolerate it because if he's got a chronic lung condition, he may find it hard to breathe with a mask. Great. So what other actions do you think you might take now once you've moved him away from others? You've got protection on, and I didn't put eye protection there, but I might in brackets add that too, to make sure we think about the eye protection. And then what would you do now, do you think? Yep. Donna, ask him. Yeah, excellent. Ask him to move to an isolated area. Request, yes. Ask him if he's feeling unwell. Very good. Isolate from others until transportation can be arranged to return him home. Excellent, excellent. Staff supervising should wear appropriate PPE. Arrange for him to go home. This is all excellent. Excellent. Great. Yeah, ask him about his other symptoms, for example. Well, assess him, I should say. So ask him, do you have, tell me about this cough, and anything else. Maybe potentially even check his temperature if he is not communicating very well. But I'm not sure if that's something you routinely do, but it's useful to have a thermometer nearby just in case, and get him home in your usual way. But yes, keep him isolated until that's possible, make the arrangements. Excellent, excellent. And then what would you do after he's left? What do you think is an important thing to do after he's left the scene of the crime? Well, Joanne's already got it there. Cleaning disinfection of items he was near or he touched. And that's exactly what I was going to say too. You'd clean your hands, obviously, and then thorough cleaning and disinfection of anything he touched and any nearby surfaces. And I guess another thing would be remain vigilant that, in case other people start getting symptoms. But that's great. Thanks, guys. That's terrific. So in summary, what we wanted to share here is that pollution, for example, CO2 emissions and plastic critically impact health, that infection prevention control has a major role in both creating and combating this, that environmental sustainability and stewardship does align with best practices in infection prevention and control, like risk assessment and ethical considerations. And as healthcare providers, we can make a difference simply, really, by cleaning our hands and using a risk assessment approach for mindful use of PPE. So that's all I really had to share. That let us be part of the solution in this, right?